that was the reason. I think since it's two of you, if you go a little over, that's fine. I mean, we're not holding you exactly to it. And we're really obviously very interested in your project since it had to do with our site in Guatemala. And I think we should wait exactly till 12 so that if there are any people that come in, we give them a chance to start. Do you guys have any questions?
I don't have any questions.
Yeah, I don't think so.
Okay, how was the experience? It's frustrating because you didn't get to go down to Guatemala. And I'm sure that was both disappointing and frustrating.
Yeah.
But the experience of doing a kind of global health project, but staying in Colorado, how did that work out?
I think for our project, it worked out pretty well actually, because we were able to put a lot more effort on the front end of making sure that the project is in a really good place before it moves forward, since it is a pilot project. And I also think we have the door open to potentially travel there during fourth year or something like that. So I don't feel like we totally lost out on that opportunity yet.
Yeah, it was definitely a bummer not being able to go down there. But like Laura said, we were pretty lucky that our project was able to continue even without being on site. So we're very grateful for that.
And who were the mentors for your project?
Amy Knott.
Uh-huh.
Mm-hmm.
She's terrific.
Yeah, she's awesome. We're very thankful that she was working with us. She's wonderful.
She really is. Well, that's great. I think there are positives and negatives associated with having been caught in COVID. I really do hope that you'll both have a chance to go down and visit the site, because it, especially after what you've been doing, it gives you a sense of things. And there are a lot of really exciting things that are happening there. So let me, just before you start, I think Peter joined us. Hello, PK.
Oh,
hello,
hi.
Peter.
Hi, Steve.
Hi, Peter, are you back? Are you back in the mainland, or are you in Hawaii?
I'm still in Hawaii here.
Oh, on which island?
Big Island.
Okay. Terrific.
Very nice.
Yeah. I'm actually in Kauai.
Oh, great.
Taking a little time. Calvin,
Nice place to be.
Cal, welcome. Thank you for joining us.
Thank you. Good to see all of you.
Okay, so I'm going to turn it over to our guest speakers. And I think, as people heard, will be one session today and then another session on the 13th. And today will be the short session. We wanted to make sure that we could accommodate all of the students, and that's why we divided in two. So I think it's 1 minute after. We've given everyone a chance to get on, so take it away.
All right, I'll just go ahead and share my screen. Can you guys see that?
Yeah, it looks great.
Okay.
Yeah.
Yeah.
All right, so we can get started. So I'm Laura Maurer. I'm a second-year medical student. I worked on this project with Lauren Norheim, who's presenting with me. She is a second-year PA student, and we will be presenting on our pilot project that we're working on for online midwifery education modules aimed at the maternal health staff in Trifinio, Guatemala. So to begin, we have no conflicts of interest. Our IRB number is listed here, and we're presenting because we thankfully received the Calvin L. Wilson Scholarship for Future Leaders in Global Health.
Yeah, so like we were talking about earlier, Laura and I were supposed to actually go down to the Trifinio Center in Guatemala to conduct our project. Obviously, everyone's plans got shifted around due to COVID, but thankfully we were still able to do a lot of our project. So as many of you know, the Trifinio Clinic is in Guatemala, and a little bit of background, it was originally created with the intention to help increase access to healthcare in the region. So for years, there was no available healthcare providers unless patients traveled all the way to Coatepeque, which is over an hour away. And although a lot of CU Anschutz students and faculty go down to the site, it's actually run by a Guatemalan physician and a team of Guatemalan nurses. And it has a family med center, a dental clinic, a pharmacy, community health programs, and also a birthing center.
So I thought we would start with a little bit of background. The pie chart above shows the percent of pregnant women in Trifinio and where they give birth. So this data is from 2018 to 2019. This actually shows progress made by the program called Madres Sanas, which is a program through the Normal Trifinio Clinic, where nurses from the clinic make prenatal home visits to around 300 women. This program helped decrease the number of in-home births from 40% to 25%, which is the number that you see above. But we all know that there are significant risks to the mother and the baby with home deliveries. So that's why the Trifinio Birthing Center was opened. It was opened in 2016. It's been non-functional, and I'll go into that. So the decision to open the birthing center was made to increase access for women in Trifinio to give birth at a formal clinic that's far more accessible than the public hospital. It is intended to be staffed by local nurses and traditional birth attendants who would undergo training to give women this more accessible option. But previous training was actually run by our mentor, Amy Knott. She ran real-time lecture sessions through video chat, but the training was really strained due to a high turnover of nurses and the need to have synchronous schedules between the nurses and the trainers. So these problems all contributed to the fact that the clinic has not been able to remain open due to a lack of trained staff. So this is where our project comes in. Our project aims to develop a system to provide reliable training to nurses so that they are able to staff the clinic. So our project focuses on creating a set of educational modules that the nurses at the clinic can access anytime online to complete their training. So the idea would be to reduce the dependency that they have on accessing real-time lectures for their education. However, with this model of online learning, we anticipated a need for an element of personalization in order to increase success with this design. So we plan to make educational modules with an element of remote mentorship for participants in Guatemala with experts in the US, mostly at CU. So in order to create the modules, we know that we needed an internationally recognized framework to help guide the content of the program. We decided to use the International Confederation of Midwives, or the ICM competencies, because they set forth a framework of standard competencies and skills that midwives should have in order to safely practice. And they do this in collaboration with the WHO. The document is updated every few years to make them more accessible and simplistic, and they're really meant to be used for resource-limited settings. And since there is no nationally established program in Guatemala for midwifery training, we felt that basing our educational modules off of this guide would be the best approach to creating a program that reflects the standards of a reputable cross-cultural organization.
So as Laura mentioned, really the main purpose of our project is to pilot this mentored and self-paced module framework to allow these nurses at the Trifinio Clinic to become skilled birth attendants. And overall, we really want to decrease the dependency of the nurses on training from University of Colorado faculty so that they can work as skilled birth attendants on their own. And so these are our methods. Next slide. Which we'll just go through stepwise throughout the rest of the presentation.
Yeah, so we will start off by talking about the evidence tables that we developed. We did this with the help of a student named Emily Barrington. She's a pre-med student getting her bachelor in public health at the University of Colorado, Denver. So these evidence tables are meant to review articles and scholarly papers in order to investigate the topics listed. This was just to make sure that this was going to be a feasible project based on projects that have already been done in the past. So the first evidence table addresses how healthcare professionals have been trained as skilled birth attendants in the past in Guatemala. It put forth experience from 4 papers, which detailed the success of in-person pilot programs for skilled birth attendants in Guatemala. None of these are ongoing. Like we said, there is no formal training available now, but it basically showed that there is a recognized need for skilled birth attendants in Guatemala, but training programs have been inconsistent. And the main limitations to these training programs have been a language barrier and perceived stigma for traditional birth attendants in the clinical setting. The next question that we were looking at was, does mentorship support e-learning in a global health setting? This evidence table looked at 5 programs which had mentorship in various forms, such as an online chat forum or personalized assignment, review and feedback by mentors, or even texting with mentors. And this found that mentorship is feasible and it is accepted by students in a global health context, but limitations were access to internet and, again, a language barrier. Finally, we looked at are distance e-learning programs acceptable and feasible in low resource settings in general. And we found that they are feasible and accepted. The main limitations are keeping students engaged, however. So we plan to address these barriers by having obviously all of the materials in Spanish. We investigated the availability of internet access to nurses through a survey that we'll go into a little bit later. And we are going to ensure the involvement of trusted community members. We work closely with the head nurse at the Trifinio clinic in Claudia, and we will have interactive lessons and meaningful discussions about content with mentors to keep students engaged.
So after making these evidence tables, we started a pre-pilot survey, and this was to better understand the preferences of the Trifinio community nurses, because we really wanted to create a program that was catered specifically to their needs. So the survey consisted of 22 questions, and it fit into 6 main categories. And the first is the motivation to complete the course. And so we found that most of the nurses felt that this training would be really beneficial to have the skills to become a skilled birth attendant. But there were various mixed interests in the style of e-learning and self-directed training with a mentor, which we'll talk more about in the perceived barriers section.
So first, we wanted to know which topics in the ICM handbook should be emphasized more, because the handbook includes a ton of topics that range from interpersonal and professional development to very logistics-oriented clinical skills. So of the potential topics and skills that we suggested to the nurses in this question, the nurses tended to prioritize modules that focus less on general abstract competencies and more on clinical action and helping families plan for pregnancy. So although all of the topics in the ICM will be covered in the training, given the issue of time constraint for the modules, we thought it would be helpful to know from the nurses what they would like emphasized in this education. We also asked them about their preference of working with a partner or in a team of 3 or more, and how they prefer to learn new skills and how they prefer to be assessed. So what we found was that a large majority prefer to work with a partner. They prefer to learn with videos or discussions with their mentor, and they prefer to be assessed through multiple choice or free response questions. So we can really use this information to help guide the emphasized content and the logistics of how information is presented to nurses in order to tailor a program to their specific needs. So we also asked them what past experience they have with e-learning, just to get a sense of where everyone's at with this. And to our surprise, many of the nurses had prior experience. Over 2/3 of them did with online learning. So it's not an entirely new way of learning for them, which is good.
And we then asked about available time and resources, which was a super important category to ask about, because we thought about making the program 18 months long, but then we found out that the nurses really preferred to finish the entire course in 6 to 9 months. And we also discovered that the nurses had around 5 hours or less of Wi-Fi access a week, which meant that the modules needed to fit into this time frame. So that was really important information to gather before creating an entire educational plan. We also wanted to make sure that there was a unified understanding of what a mentor is and their role, in order to make sure that the mentors had a list of expectations on how to support the nurses, and also how often the nurses wanted to be in contact with their mentor. We found it interesting that over half the nurses preferred to have a shared mentor with another nurse. So that gives us a lot more options when assigning mentors in the future.
Next, we looked at perceived barriers to success. This was based on free response answers by the nurses. So the majority of them mentioned something about time constraints or maintaining attention and self-discipline to complete the material. And other concerns included language barriers, internet reliability, and ability to practice skills in real time. We are hoping to address the discipline and attention issues with partners and mentors to keep everyone engaged. And then the time constraint will obviously be the biggest hurdle that we're going to have to address in this program. Next, we made a process map to give to experts who are creating the content on how to actually build the module. So this is basically just framework of how they would approach building their module. And so first they will start out by reviewing the ICM handbook and their assigned competency. They will then establish 5 to 20 concrete learning objectives, depending on the length of their competency, and gather the resources based on the survey input that we've provided them. They will make the module on Google Docs, that's the platform that we'll be using, and put resources in order with pertinent notes. And then finally, they will be creating assessments, and those assessments will be separated based on clinical skills versus medical knowledge. So clinical skills are going to be assessed in the clinic, and quizzes will be used to assess medical knowledge. And then the last piece to this is the quality improvement aspect. Obviously, this is a pilot project, so after after each module, there will be a post-module survey for the nurses to fill out, and we will use this to help refine the modules.
All right, and the last thing that we worked on was a course logistics packet. So like any course you enroll in, there's a syllabus that outlines how that course works. So we built this for the nurses so that they have a clear approach to how to navigate these modules, as well as how to work the Google Drive, and then how to evaluate the module at the end. So here's an example of a few pages of the nurse handout. It's currently being translated by a PA student, Itzel Martinez, and it outlines step-by-step how to access Google Documents and where to find the modules and their resources. The handbook also includes a template with descriptions on how to approach each section and purpose in the context of the overall module. So as you can see, it includes how many hours of study will be needed, the learning outcomes, all the resources to complete, a skills checklist that will be checked off by the charge nurse, learner assessments and review questions, as well as a final quiz to complete.
All right, so that brings us to our future work. Piloting the module has gotten delayed a bit just due to other projects going on in the Global Health Department, but we are piloting the first module with nurses who have agreed to participate, and that's going to happen in April. And then we will have a post-pilot survey to compare expectations versus reality of actually completing the module. And then we will refine based on that feedback.
So this is an article that Amy Nacht and our team published to outline our project. And we hope that this project will not only have a huge impact on the Trifinio community, but also inspire other communities to use distance learning to strengthen their clinical teams. So especially with the restricted travel with COVID, we have the opportunity to redesign how to empower communities and better address health concerns through distance health education.
So that brings us to the conclusion. We would like to thank everyone who joined the Zoom meeting and who has been working on this project with us to make it happen, especially our mentor, Amy Knott, and of course the Center for Global Health for funding us to do this work. A huge thank you to the Calvin L. Wilson Scholarship and for everyone else who has contributed to this, including Margot Harrison, Emily Barrington, Emily Himes, Itzel Martinez, and Claudia Rivera.
That was terrific. Thanks so much. I'm going to call on Cal, since you were funded through his scholarship, to say a few words. Cal was the director of the center before I became director and has had an incredibly distinguished career in global health. So Cal, your thoughts?
Yeah, several thoughts really. First of all, the presentation just the mechanics and the style and the giving of the presentation was one of the best I've seen in a long time. You guys really honed that well. I love the way that you went back and forth. I really liked the setup of your slides. They didn't have too much information in them. It was just the key elements. Nice graphics. All that was just beautifully done. But at the same time, I have to confess that when I realized that all of the recipients of the Global Health Scholarships were going to be staying in country instead of being able to travel, I had serious doubts as to what might transpire, frankly. I really liked the approach that you took. I think you took lemons and made lemonade out of it in terms of identifying a need in Guatemala, identifying, doing as much of a needs analysis as you possibly could under the circumstances, taking that needs analysis and then coming up with a good plan and beginning that plan. It was, I think, a very good first step to hopefully what might be continued over the next couple of years. Do either of you plan to actually go to Trifinio in your fourth year, by any chance?
I really hope to. I have no concrete plans because we don't have our schedules yet, but the beauty of this project is that it is so new and I don't foresee it ending anytime soon. So I think it will be an available option.
Yeah, I'm hoping, since I'm a PA student, we have 3 years of school. So depending on whether our campus clears students next year, I would absolutely love to go to Trifinio. So that's definitely something I'm hoping for, but also keeping in check the reality that COVID is still going on. So who knows?
Yeah, right. Well, I really think you're to be congratulated. Frankly, your report exceeded my expectations, and it was very, very nicely done, given the constraints that you had to work with.
Thanks so much, Cal. And we're going to be in the same bind this year, but having seen and heard this presentation, I really feel the benefit of continuing to fund these types of projects, even if people can't go, is certainly worthwhile. I'd like to ask Peter. Peter Durst has been, I think, the longest benefactor to students in terms of the global health research projects. He's always been there for us. And the us, I want to say, especially the students. And usually when Peter's in town, we hold this event in person in his gallery, which is always a treat to be at. So your thoughts, Peter? You may have to unmute.
Peter, I think we muted you. You could unmute you.
Okay, I hope you can hear me.
We can hear you. Thanks, Peter.
Thanks for putting me on the spot there. But fortunately, Cal gave said much of what I was thinking. I was so impressed by your ability to transcend the problems that we all face under COVID and go forward with the study. I am also amazed and delighted that you have done this in such a wonderful fashion, that it gives me hope for this next year as well, and the other projects we have coming forward. But just to reiterate, I am very impressed with it and very enthusiastic about the future of the program. So kudos to everybody.
Thank you, Peter. PK, your project will be coming up on the 13th, but PK is really, I think, probably the world's leader in asthma education programs. And with COVID, the concept of potentially doing more online asthma education programs, and maybe we ought to recruit both of you to develop an asthma program. But PK, your thoughts?
First of all, thank you for allowing me to tell you a few words. And the presentation was very good. For a few minutes, I felt like there was no COVID, because the way the lady presented with all the work she did by going there in person and did it, it's amazing that she was able to do it in the middle of the pandemic. So congratulations. And I like the slides. I like the presentation. But this is not in my field, so I cannot comment on the subject matter. But I really look forward to doing something in my field in Guatemala, down in the road, if possible. And I congratulate all the participants. And also we are quite active doing online. I'm almost doing a couple of Zooms every week with asthma allergy education in India as well as in a few other countries. And I'm leaving for India in 2 weeks. And thank you again for giving me this opportunity. And congrats again for our medical students for doing this wonderful job.
Thank you, PK. I'll just make a few comments, and I don't know, but maybe before I do, is there anyone else on the call who would like to make any comments? Well, I'm sorry that Amy's not on the call. Let me first thank Desi and Mary for putting this together. I really appreciate it. I just want to give everyone some context in Trifinio. We have been having problems in terms of keeping our nurses. And one of the main reasons is that we do a very good job of training our nurses, but the Ministry of Health has tried to recruit them away and offer them more money than we're offering them or they're getting paid. And many of them live closer to the town of Coatepeque, and they can work in Coatepeque and not have this hour commute. But what we hear from our nurses and our staff, part of the reasons they stay at the program is the opportunity to acquire new skills and new training and to advance their careers. And I think that's why this type of program is so important, because I think our nurses really appreciate the opportunities that are given to them to expand their skills, to become nurse midwives, to learn to do different things, not to have a ceiling, but especially in the research as well as service area, to be able to grow and to really mature and have additional career paths. And I think that what you've done is created a very important opportunity for them. So I hope that came across as you did your research, but it certainly has come across to me, especially in the last 4 to 6 months, as we've been struggling with some nurse turnover. So I agree with all the speakers, just a terrific job. And I'd like to maybe end with giving both of you a chance to, if there's anything that you'd like to say in addition, after getting the feedback, I'm sure that we'd all love to hear your thoughts on this. Laura and Lauren.
Yeah, I just want to thank you all so much for being here today and for giving us these opportunities. We also didn't really know how the project was going to change with COVID. And of course, you know, a lot of the direction that we took was through the advice of Amy Knott. So she deserves a lot of this credit that's being given. But yeah, I just want to reiterate that we're all so thankful that you guys are still willing to believe in students and help us do these projects. It really means a lot.
Thanks, Laura. Lauren?
Yeah, Laura said it so beautifully. I don't know how to say anything after that, but yeah, I just want to say thank you so much for giving us this opportunity to work on this project. I know it's been something that has kept me motivated in PA school, just knowing like, oh, this is something I want to do with my life, and keeping me going and just reminding me every day like why I want to be a healthcare provider. So I just want to thank you for this opportunity, and it was just an honor being able to present to you guys today and meeting all of you virtually. So thank you so much.
Great. Well, Lauren and Laura, terrific job. Thanks for sharing this time with us. Thanks for everyone who joined us. And please feel free to join us on the 13th. I think it would be fun to hear the other presentations as well.
Steve,
yes?
I think it is 12th, Friday.
Yes.
Yes,
The
that's
12th.
correct. It's Friday the 12th.
Friday the 12th. Thank you. I don't know what I had Friday the 13th in my mind. It's Friday the 12th. That's much better. Okay, everyone. Take care. Stay safe.
Thank you. Bye-bye,
Thank
everyone.
Thank you, everyone.
Thank you. Good luck.
Okay, bye-bye, y'all.
Bye.
Thank you.
Bye. Thank you so much.